Have you ever experienced that uncomfortable burning sensation in your chest after a meal, or a sour taste creeping up into your throat? It is more than just an inconvenient feeling. It is often a sign that a very important muscle in your body might not be doing its job perfectly. Understanding why this happens is the first step toward finding relief. The lower esophageal sphincter, or LES, weakens primarily due to a combination of lifestyle choices, dietary habits, and sometimes underlying medical conditions. Essentially, this ring of muscle at the bottom of your esophagus can become overly relaxed or lose its normal tightness, which then allows stomach acid and food to flow back up into the esophagus. The core reason this happens is often linked to things that directly influence muscle tone or increase pressure on the stomach. Certain foods like fatty meals, spicy dishes, caffeine, chocolate, peppermint, and alcohol are notorious for directly relaxing the LES muscle. Lifestyle factors such as smoking, with its nicotine content, and obesity, which creates increased abdominal pressure, also play a significant role. Furthermore, eating very large meals can distend the stomach, putting pressure on the LES, and eating too close to bedtime means you are lying down when digestion is most active, making reflux easier. Even some medications, like certain blood pressure drugs, asthma treatments, and antihistamines, can contribute to LES relaxation. Medical conditions such as a hiatal hernia, where part of the stomach pushes up through the diaphragm, physically prevent the LES from closing properly. Pregnancy also can cause weakening due to hormonal changes and increased pressure on the abdomen. While many factors can lead to a weakened LES, you can take steps to help manage this. A simple yet powerful approach involves identifying your personal trigger foods and making mindful adjustments to your diet. For instance, keeping a food diary can reveal specific items that consistently cause your symptoms to flare up. Also, eating smaller, more frequent meals instead of 2 or 3 large ones can significantly reduce the pressure on your stomach and LES. Aim to finish your last meal at least 2 to 3 hours before lying down for the night, allowing gravity to assist digestion. A key insight in managing LES weakness is understanding the diaphragmatic crura, which are fibrous bands that form part of your diaphragm and act as an external pinch on the LES. When these crura are healthy and functioning well, they add an extra layer of protection, keeping the LES tightly closed. Damage or weakening to these crura, often due to obesity, chronic coughing, or strenuous activities that increase abdominal pressure, can further compromise the LES, making reflux more likely. This dual mechanism, involving both the internal LES muscle and the external support from the diaphragm, underscores the complexity of preventing reflux. By adopting simple changes to your eating habits, managing your weight, and being aware of potential trigger foods or medications, you are actively working to support your lower esophageal sphincter. These small, consistent efforts can make a substantial difference in reducing discomfort and helping that important muscle do its vital job of keeping stomach contents where they belong, allowing you to enjoy your meals and your day with greater ease.